This is it, the night before your first clinical session. You're wide-eyed, staring at the ceiling. Your scrubs are already laid out on your chair. You feel the sweat of your palms and the beat of your heart in your quiet room. Only hearing the thoughts of something can go wrong repeating in your head. You think to yourself, you've already practiced your skills. You've already passed your tests. You know what to do. So why are you now only having second thoughts? Maybe you're wondering to yourself if you actually belong there. Or maybe that you just got lucky getting this far. These thoughts and feelings I'm telling you are experienced by many other people who are finally starting their first day of clinicals. I know all this because some of these thoughts were things I was thinking to myself as well. Hello everyone, my name is Senor Bonez. I may be a certified nurse aide now, but back then I was in your same position. If you are feeling any of what I said now, then stick with me, because by the end of this video you'll know exactly what to do to walk into your clinicals and pass. The first thing I need to tell you guys is to clear your schedules. Make sure that you reschedule your doctor's appointments, any family meetings, or any meetups with your friends. I say this because clinicals take priority, and if you miss a single day, that might just be the reason why you fail. Again, I say all this because missing even one day means failure for you, unless you have a really, and I mean really, good excuse as to why you couldn't attend that day. See, I'm talking about an Avengers level threat kind of excuse. Again, so please make sure your schedule is clear the week of your clinicals so that you can pass them. What are you doing still watching this? Go check those schedules, clear them out, and come back to this video. Moving on, the second thing I want to tell you guys is to arrive early at your clinicals. While arriving 15 minutes early is pretty much the standard for any occasion, I say make sure you arrive 30 minutes early. I say this so you guys don't take any chances of failing your clinicals. Heck, arrive an hour early if you're that anxious. I was the person that arrived an hour early. That's besides the point. Anything can happen, alright? You can run out of gas, there can be traffic, there can be a train, you can hit every red light there. Just make sure you take the time to leave early so that if anything happens, you can still make it. Arriving early also gives you the time to be prepared and get settled into your new environment. Cause let me tell you, you do not want to be looking for where you're supposed to be as soon as you arrive. I just like to say it's better being safe rather than sorry. Again, we are trying to increase the chance of you passing your clinicals, not failing them. Alright, now I want to talk to you about preparing your supplies. I just want to give a disclaimer and say what I'm about to say here completely depends on who you're taking your program with. Some programs may be more chill about what you bring, while others will be more strict on what you bring. Alright, now things I consider must bring for your clinicals are your correctly colored scrubs, and just make sure the pants of those scrubs aren't dragging on the floor. Either make sure you get them in the right size, or do what I did and just staple the pants so that they don't drag on the floor. Just cuff them up, go bah, bah, and you're set. Also make sure you bring a watch with a second hand so that you can correctly count vitals if needed. Make sure you bring some non-slip shoes, a pen, some hair ties, a water bottle, a notepad, hand sanitizer, and lunch. I know I went through that a little fast, but you can always play the video if you need it. And again, everything I just included completely depends on your program, but those are things I highly recommend you bring because most likely than not, you're gonna need them. Now that we're done with the topic of preparing your supplies, let's move on to preparing yourself. Again, everything I'm about to say here completely depends on your program, so keep that in mind. Alright, to prepare yourself, make sure you do not bring any colognes or perfumes. I say this because some of these scents may be too strong for the residents or they may be allergic. Make sure to also not bring any jewelry, especially dangling jewelry, as it can get in the way of any assistance you're doing with residents. Also, make sure your nails are trimmed, as having long nails can have bacteria get stored under them, which then could eventually make your patient sick. So keep your nails short, and I say a good range is just making sure that your nails are not over the fingertips. And the last thing you probably shouldn't bring is your phone. Now, this last one entirely depends on your program. I'm not saying don't bring your phone to clinicals for this one, but what I am saying is make sure that you don't use your phone while in clinicals. You can use your phone for your lunch, or you can use your phone for a break, but not while attending residence. Again, this might entirely depend on the program you're taking, but for the one I took, it was only phones during lunch. Also, I know I'm just some random guy on the internet, but please take what I'm saying to heart, as these preparations can be the difference on whether you pass or fail. One of the next things I want to talk about is not freezing during your clinicals. I'm gonna be honest, a good chunk of you will freeze up during your clinicals, but what's important is that you don't stay frozen. I understand with multiple high-stress situations, it's really easy to get overwhelmed and not know what to do. It's completely normal, and do not feel bad about it. My best advice for not freezing is just don't think and go right into whatever's happening. Don't overanalyze anything and just go straight for the action, as the person who will be analyzing and thinking will be the other CNAs that are in charge of helping you through this whole clinical process. Just ask where you can help and they'll direct you to what you need to do. Just jump in, be quick, and adapt, as doing these things will make you freeze less frequently. Of course, all this is easier said than done, but I know you guys can do it. On the topic of asking CNAs for help, you can also ask them questions. This is the next topic of things that I want to talk to you guys about, but I already hear you typing. Senor Bonez, I've heard way too many horror stories on people going to their clinicals and having bad experiences with the CNAs there. They're just annoyed and irritated with you and just don't want anything to have to do with you. And to that I say, yeah, it does happen. Listen, I don't want to lie to you guys and say that that actually doesn't happen during clinicals. And yes, luck also does play a factor in where and who you're working with. But to counter that argument, I just want to say that that's not always the case. Some CNAs actually don't mind responding to your questions. Listen, I don't say any of this to scare you, but I want you to be aware of the truth, and that's just how things are sometimes. But regardless of any of this, make sure you continue asking questions, as this lets the other CNAs know that you're actually invested into what you're doing and that you actually want to help. Again, just don't be afraid to ask questions, and if the CNA you are with is acting mean to you, just make sure to let your teacher know. Moving on, I now want to talk to you guys about prioritizing your rest. These clinicals will have you working long shifts, either early mornings or late nights. And these clinicals will most likely span you multiple days. So with that said, prioritize your sleeping and your eating habits. Make sure you're eating healthy the week of clinicals, and make sure you are getting a good amount of rest each day when you come back home from clinicals. The hours will eat away on your energy, but the point of clinicals is just to show you what the average CNA experience is and to see if what you're doing is right for you. Again, I know you guys are able to do this, especially if you're just a couple days away from your clinicals, because that means you've already done all the training and you are prepared. And for all I know, you're probably not days away. You could literally be in the parking lot of your clinical area right now. And if that's the case, then I know you still got it, because I know that I was a person watching these kinds of videos in the parking lot as well. Sorry for that. Alright, while I take the time to calm down, I just want to say, if you guys have found any of the information in this video valuable to you, I would really appreciate it if you guys like this video and subscribe. It helps me in the channel enormously, and it would help me produce more videos such as this one. With that said, let's move on to the second to last thing you guys need to know before your clinicals start. That thing is the job possibilities that come with your clinicals. These clinicals might actually offer you a job depending on your performance. If the staff at your facility see that you're passionate about your work and that you're putting yourself into the work that you do there, they might just offer you a job. This is also actually great news if you like the facility you're working at the moment. And this also makes getting the job you want easier, especially if the facility you're going to work at is one sought after by many others who want to work at that same facility. Again, just try your best, commit yourself to what you're doing, and you might actually land a job there. Alright, now for the final thing, and that is that everyone who goes into these clinicals will have a different experience with it. Some of you may have liked your clinicals, and some of you probably didn't like your clinicals, but that's what these clinicals are for. These clinicals help determine how passionate you really are about being a CNA or just having anything to do with helping people or being in the medical field. And going through this whole program and attending these clinicals is a great way to see if these kinds of things are for you. I know that can be a pretty broad thing to say, considering the fact that certain medical professions don't really require you to always interact with people. But I say if you just overall want a great taste into what it can be like to be in the medical industry, I say this is a pretty good experience. Going through this experience is really a great way to see if you really like helping people in this sort of way. Of course, there are multiple ways to help people, and this way isn't the way for everyone. But what matters is that you now have the experience and knowledge of what this whole process is like, and can now decide whether or not this type of thing is for you or not. And with this knowledge, you can just take it and move on to the next thing in your life, whether that's something more than just CNA or a completely different profession. Again, these experiences are really not something that can be put into words and are only something that you can experience. So if you do have the chance to go through the CNA program and do these clinicals, then I highly recommend it. With all that said, thank you so much for making it to the end of this video. I hope I was able to get rid of any anxiety or stress that any of you may have had. Other than that, if you guys enjoyed this video, I would really appreciate it if you liked this video and subscribe to the channel. Again, it would really mean a lot to me and would help me produce more videos such as this one. I hope you guys were able to get something valuable out of this video, and have a great rest of your day.